This presentation is regarding practice-based developmental and behavioral interventions to enhance quality of care in the first 3 years of life. It is in partial fulfillment for the Doctor of Nursing Practice program for the course Biostatistics for Dr. Vicki Krentz. Why do we need this program? There's evidence that there are deficiencies in the quality of care for children. They have lack of preventative care, lack of usual source of care, especially among minorities and low-income families. Specifically, there has been limitations noted in the behavioral and developmental areas of care, and the gaps extend to differences between recommended care, so the evidence-based care that they're supposed to receive, and the care received or actually provided to the patients by their providers. The Healthy Steps for Young Children program was designed to meet the needs of families regarding their young children's early development and behavior by enhancing relationships between parents and their children, between families and the pediatric practice, and among practice members. Healthy Steps aims to enhance the capacity and effectiveness of pediatric primary care by incorporating developmental specialists into the pediatric practice. The program was designed for all families, not only those at risk for developmental and behavioral problems, recognizing that all parents have concerns and questions about their children's health, development, and behavior. The Healthy Steps program included contact with a practitioner specially trained in the Healthy Steps Behavior and Development program. These providers were called Healthy Step Specialists. The Healthy Step program consisted of 7 services to these intervention families. They enhanced the well child care. They got a developmental assessment for every child. They provided 6 home visits. They set up a telephone hotline and were available to give advice. They provided written material pointed at prevention of certain diseases and safety issues and health promotion. They also assisted in forming parent groups and encouraged participation for the participants. They also provided referrals and community groups and got them set up. So the purpose of this study was to test the impact when implementation of the Healthy Steps program was provided. The parameters they were looking at were how it affected childhood health care and parenting practices. This study was a prospective controlled clinical trial. They used 6 randomized and 9 quasi-experimental sites across the United States. There were 5,565 children enrolled at birth and followed for 3 years. The flow chart shows the randomized sites and how they assign to the intervention and control group, and also the quasi-experimental sites and the recruiting of the intervention group and the control group also. These are the demographic and characteristics of the participants. Most of them are very similar. There is a slight difference in that the mother's education was a little bit higher in some of the groups. They were slightly more Caucasian in race. And in some of the groups, the family income was a little bit above middle. The measurements they used in the study were the quality of care outcomes were in 4 domains. They categorized them into effectiveness, which was the receipt of the Healthy Start services, patient-centeredness, how satisfied they were with their experience while seeking the care, timeliness, so adherent to their visits and vaccination schedules, and efficiently, which was avoiding wasted resources, and continuation of care at 20 months. They also measured parenting outcomes, and they looked at a variety of parenting outcomes, which were their parents' response to misbehavior of the child, perception of the child behavior, and promotion of the child's development and safety. For the outcome measurement of effectiveness, they looked at a variety of elements. They looked at if they received 4 or more healthy step-related services. They could be any variety of those. And they did look at a Cronbach's alpha to make sure all these were significant and in line. They discussed more than 6 topics with another parameter, and again, any of those 6 topics when the patients were asked. If they received home visits, if they had a developmental assessment, if they received books to read to their child, and informed about community resources. In other words, were they informed and they believed that they had gotten resources to community services that they needed. The patient-centeredness outcome measurement had to do with if they felt the practitioner went out of their way for them, if they felt they were in agreement with the pediatrician or nurse practitioner support provided, if they disagreed with the practitioner, did they felt that they were listened to as a parent, and also too, if they felt respected as a parent by their practitioner. The outcome measurement of timeliness were, did they get their well visits on time? Did they get their vaccinations on time, on schedule? And were all of the vaccinations up to date? So did they get them at the appropriate time and were they up to date? And for efficiency, what they looked at the end was if they had had a visit over the past 20 months, if they had had any hospitalizations in the past year, any emergency room visits in the past year, and they also looked at when they had those emergency room visits, were they used for injury-related issues or were they other non-avoidable issues? When they looked at parenting measures, they categorized it into parent response to child misbehavior, and they looked at how they disciplined them, slapping, using harsh discipline, negotiating, or ignoring. They looked at their perception of their children's behavior. Was it aggressive, anxious, or depressed, or did the child have sleeping problems? And then they also looked at how if the parent promoted child development and safety, and they looked at a bunch of parameters around that. The data collection was done by patient questionnaires at the beginning and throughout the course of the study. We'll mention later how often they did it. They also looked at provider satisfaction and if the providers had the perception that these interventions worked and made a difference. They did patient interviews over the phone and at the beginning in person. They looked at medical records to see, collect the information about the parameters and if the patients had been in the emergency room and or they did interviews to see if they had been in the emergency room also. And then they looked at the Healthy Start Specialist logs because they wanted to ensure that they were providing the intervention that they intended to provide. So what they did is the parenting outcomes were based on frequency in which the parents used the interventions over the past 7 days from when they did the phone interviews. They put it in a scale of a 0 to 3, and 0 was never and 3 was almost always. And then what they did is dichotomize these into never and seldom was 0 and 1. And then the 2 and 3 was often and almost always. They also constructed a scale because they wanted to see really if the intervention made a difference with the harsh behaviors. And also another dichotomized approach was the slapping the face or spanking. They wanted to put those in a different category or actually look at them separately with statistics to see if the interventions made a difference with these harsh approaches to discipline. And then they also wanted to see if the interventions made a difference with the positive parenting disciplines of ignoring behaviors or negotiating with the child about behavior. They also wanted to explore the mother's depression and sadness if there was any. So they use an abbreviated Center for Epidemiologic Studies depression scale, and they looked at the alpha coefficient. It was 0.86, which was similar to that for the total scale in the general population samples. And here's the results of the quality of care outcomes. And we will discuss those a little later, but basically they found that the majority of quality of care outcomes they did make a difference on with the Healthy Start intervention group. These are the results for the adjusted odd ratios, and definitely for effectiveness, that they receive more than the 4 services, that they almost all of the children in the intervention group had the developmental assessment. They received books and read to their children more frequently. The people in the intervention group agreed the majority of time that someone in the practice went out of their way for them, and that they had less disagreement with their pediatrician or nurse practitioner about being listened to, respected, and getting support provided for them. The majority of them had on-time well child visits. They had vaccinations on time and were up to date with all of their vaccinations. They did have more follow-through and had been seen at the 20-month visit, and majority of them were continued to be seen after the program, after this 20-month, because they did follow them up to the 3 or 36-month point. Although the hospitalizations were not different in the groups, and the emergency department visits were also not different in all of the groups, the emergency department use for injury-related causes was less in the groups with the intervention. The results for the frequency of for parenting outcome is the groups that got the intervention use less harsh discipline, use more negotiation and more ignoring behavior, and had less slapping in the face or spanking with an object than did the control groups. One interesting finding was that the perception of child behavior for the intervention groups showed that the parents reported more aggressive behavior and more sleeping problems with the children in the intervention group. What the authors thought about this was that potentially it was because the parents paid more attention to the children's behavior and were looking for these things. So in conclusion, the physicians discussed more than 6 topics with the parents. They had more than 4 Healthy Start visits and interventions. More of them had developmental assessments. They said that someone went out of their way for them in the practice, and they had up-to-date vaccinations that were more in the intervention group. So we just went over this, and also too, the study through statistically significant analysis demonstrates which outcomes the interventions affected. The analysis helps us pinpoint which outcomes would be similar regardless of intervention, and the analysis helps us focus our limited resources on the interventions that will have the most impact on outcome. We use evidence-based interventions and statistical analysis to fine-tune our care, thus providing the care that has the greatest impact on the desired outcomes. The findings regarding the child's immunizations beginning up to date are also important. Although this was only one component of timeliness, it has significant implications in relation to the physical health of the child. Also, too, the findings regarding the depression symptoms are important because postpartum depression is underreported, and anything we can do to intervene and identify risk for postpartum depression helps that population. Thank you.